Hi, Ramsey Choucair. I am a board-certified plastic surgeon in Dallas, Texas, and today, our continuing series on body contouring, we're going to speak about the different types of anesthesia that can be used for liposuction or suction-assisted lipectomy. And many patients come in and say, I know that I can do liposuction under local anesthesia, where I can literally drive to your office, have it done, and drive home. And that's true. And then other patients say, well, we really don't want to have general anesthesia. I want to do it with just a little sedation and local. Well, you can do liposuction in any part of the body typically under straight local, which means you don't take any oral sedatives or medications. You just simply have injections of local anesthesia, which can make you very comfortable. And as a surgeon, we can remove fat. The key is how much fat, because most patients want an improvement or have an expectation that is of a certain degree. And at some point with just local anesthesia, there's a limit to how much fat and how much improvement you can obtain. So it really comes down to that simple fact. Recall that if this is your muscle and this is your skin and we're removing this fat layer, it's very easy to take the very top of the fat layer under local anesthesia. But most patients want as much fat removed within reason to make the area that they're concerned about look good. And at some point, you can only take so much fat before the local anesthetic is ineffective. And therefore, as a surgeon, you're limited. Now, the next level is local anesthesia with either oral sedation, no IV, or an intravenous sedation given usually by a nurse practitioner or an anesthesiologist. And in that way, you're allowed to have more local and allowed to do more of the liposuction to create the improvement because you're also relaxed and your senses are a little bit dulled, so to speak. That can carry you to the next level of how much fat to remove. Ultimately, if most patients want as much fat removed as possible, yet making sure everything looks good, it requires general anesthesia, which basically means you're not conscious enough to be able to communicate with the surgeon during the surgery. That can be anything like a colonoscopy anesthesia. It's basically any time you're under anesthesia to the point you're not aware or able to speak. And that's what most of liposuction is performed under, because that's where we can create the most improvement. So there are many options when it comes to liposuction and the anesthesia options. The key is matching what the surgeon and the patient want to achieve with an anesthetic that keeps you comfortable and, of course, safe. So I hope that gives you an overview of the options for anesthesia.